Suswagatam. You are all welcome to Saspandan TCM Academy. आज का सब्जेक्ट है डिस्यूरिया, मीन्स पेनफुल एंड बर्निंग यूरिनेशन. Dysuria. It is painful. This is the session's name, acupuncture for painful burning urination. So we are going to discuss this subject. So this is जिसको ये प्रॉब्लम होता है वही वो बेयर करता है. बहुत मुश्किल है, ये बहुत पेनफुल रहता है, बर्निंग रहता है. ओके, सो दिस इज बिकॉज ऑफ damp heat in the bladder. It's the damp heat. In bladder, damp heat in the urinary bladder. So what is the concept? Concept is this pattern is credited to invention of damp heat in the bladder. So damp heat damaged the function of the bladder. Okay, this damp heat so damage the function of the bladder. And according to Sanjio pattern is the triple hormone pattern. Triple hormone, 3 burners, Sanjio patterns. This is the Sanjio pattern differentiation. It is belong to lower GAO. Okay, we have the 3 GAO. We have the 3 burner. GAO means burner. We have the 3 burners, 3 GAO, upper GAO, middle GAO, and lower GAO. Okay, and this pattern is belong to the lower GAO. Then, what are the clinical manifestations? Clinical manifestation. So there is the frequent and urgent urination. The first, so frequent and urgent urination. The bloating and pain in the lower abdomen, bloating and below the navel. There is a bloating and the pain in the lower abdomen. Burning pain on the urination when you are going to urinate. Okay, there is the burning pain on the urination, and urine is the scanty dark yellow urine. So what is the type of urine? That will be scanty. Okay, very little urine and dark urine, dark yellow urine, or unclear or cloudy urine. Okay, clear urine will be unclear or like cloudy. Okay, and hematuria. What is the hematuria? Hematuria, there is the presence of blood in the urine. Hematuria. Hematuria, stone in the urine, fever, and distension and pain of the lumbar region. Okay. If you see the tongue of the patients, the tongue will be red and yellow and sticky tongue coating. Coating will be yellow and sticky. And if you see the pulse will be slippery and will be rapid pulse. Please understand the symptoms in case of the damp, okay, damp heat in the bladder. Okay, damp heat in the bladder. So these are the symptoms. Okay, it is a frequent and urgent urination, bloating, pain in the lower abdomen, burning pain on the urination, scanty dark yellow urine or unclear or cloudy urine. Okay, hematuria. Okay, there is a blood is present in the urine. Okay, urination में blood जाता है. Stones in the urine, fever, distension, pain of the lumbar region, red tongue, yellow and sticky tongue coating, and pulse will be slippery and rapid. Okay, these are the symptoms. And what are the main symptoms? Main symptoms are, understand, main symptoms. Okay, frequent and urgent urination, frequent and urgent. Burning pain on urination. Burning pain and urination. Stone or blood in the urine. These are the main symptoms. Okay, you should understand. So let us do the analysis. Analysis. This type of patient may be due to exogenous pathogenic factors. Okay, this patient is suffer from the exogenous pathogenic factor, or it's overeating and drinking without control. Understand, overeating and drinking without control, generating this type of exposure, external pathogenic factors, exogenous pathogenic factors, and overeating and drinking without control. These types of symptoms generating the internal damp heat, both cause damp heat. Okay, so overeating and drinking without control and exposure to exogenous pathogenic factors. Okay, both generating internal damp heat, which can cause damp heat that preparing and binding in the bladder and lead to abnormal function of the bladder Qi transformation. It's caused the abnormal functions of bladder Qi transformation. Bladder Qi not transformed properly. It will be abnormal. Now, see, so see, now let us the comparison. Okay, this is the pattern flow. Bladder damp heat. When the damp heat in the bladder, okay, first it's failure to the transform chi. Okay, bladder is the failure to transform chi. Then abnormal bladder chi transformation, and its symptoms are, if there are the abnormal bladder chi transformation, frequent and urgent urination, burning on the urination, and dark yellow urine. And if there is a damp heat and evaporate the body fluid, damp heat evaporate the body fluid. But when there is the heat, it's the consume the body fluid. That evaporate the body fluid. It's after long time. So there will be stone in the urine. Okay, symptoms are the stone in the urine. And secondly, damp heat in the bladder. Damp heat in the bladder, that is the damp heat injure fluid. When damp heat injure fluid, there will be scanty urination, and damp heat damage blood network. When the damp heat damage the blood network, okay, that will be blood in the urine. When the heat steam dampness, there will be pure bukharaiga. damp heat damage the kidney. Okay, when the damp heat damage the kidney, there will be back pain. Okay, then red tongue, yellow sticky tongue coating, and slippery and rapid pulse. Okay, these are the diagnostics tool. Okay, you see the tongue will be red and yellow and sticky tongue coating, and see the pulse with it will be slippery and rapid. Okay, now identification. How you will identify identification. Okay, these patterns of bladder, damp heat, and excessive heat in the small intestine pattern have common symptoms such as the frequent and urgent urination and burning on the urination. However, the latter is due to heart fire. Okay, so burning on the urination is due to heart fire moving downward to the small intestine and include heart displeasure, that is the thirst, insomnia, and ulcer in the mouth and on the tongue. Okay, tongue ulcer, mouth ulcer. And while the previous patterns, frequent and urgent urination. That frequent and urgent urination is caused by the bladder damp heat to go together with the kidney disease. Okay, manifestation such as the fever, soreness of the lumbar. Okay, lumbar will be feel sore. Okay, and uh, because the kidney is related to the bladder in both the interior and exterior by the channels and collaterals. Okay, urinary bladder and kidney, they are the husband and wife relationship, interior and exterior relationships that the by the channels and collaterals. Now let us see the summary. See, damp heat in the bladder. Okay, so what is the etiology? Excessive exposure to exterior damp heat or dampness or cold, that emotional strain and underlying or follow up the pathology. It is the dampness and the heat in the bladder. And possible presenting conditions that the urinary tract infection or the urinary calculus, stone in the urinary bladder, stone in the urethra, and stone in the kidney. Okay. So sign and the symptoms, the frequent and urgent urination. Symptoms are frequent and urgent urination, burning urination, difficult urination, dark yellow turbid urine, blood in the urine, fever, thirst. पेशेंट को बहुत प्यास लगेगी, थर्स्ट विद द डिजायर टू ड्रिंक and hypogastric fullness below the lower abdomen and the pain, feeling hot and the sand or stone in the urine. Okay, you will see the sand. Okay, मिट्टी जैसा ऐसा क्रिस्टल निकलेंगे यूरिन से and stone in the urines. And when you see the pulse will be slippery, rapid, and wiry on the left rear position. Okay. So let us learn the pulse diagnosis in future. Okay, and tongue will be thick, sticky yellow coating on the root with the red spot. Okay, root of the tongue, thick, sticky yellow coating, and the red spot. What is the treatment principle? Treatment principles are the clear heat, and remove the damp in the bladder, free waterways, remove water and free link. Okay, and acupuncture treatment. And what you should use the treatment points. Okay, let us discuss. Okay, Treatments are SP9 and bladder 22, ST28, bladder 28, SP6, and REN 3 and REN 9. All points should be sedate. Sedate all points. Sedate. Okay. So let us see the point location one by one. You can take the screenshot for this protocol. Our first point is the SP9. Okay, this is the SP9. Okay, on the medial side of the lower leg, in the depression in the angle formed by the medial condyle of the tibia and the posterior border of the tibia. Okay. This is the SP9. Okay. Now see the video how to locate SP9. Our second point is bladder 22. This is the this point is located on the back. It is the back shoe point of the Sanjio triple armor. Bladder 22 is the back shoe point of the triple armor. Okay, this point is located on the 1.5 tone lateral to the lower border of the spinous process of the first lumbar vertebrae. First lumbar vertebrae. It is the 1.5 tune go lateral from the lower border of the spinous process of the first lumbar vertebrae. Count that there are the 5 lumbar vertebrae and locate the first lumbar vertebrae and come to lower border of the spinous process of the first lumbar vertebrae. It's go 1.5 tune. This is the location of the C. This is the bladder 22. Okay. See the video how to locate the bladder 22. Don't needle perpendicular. Always needle this point obliquely. Okay, don't needle perpendicular. Don't needle at the 90-degree. Obliquely, needle obliquely toward channel flow. Yes, 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 Jhikaji, yes. Our next point is stomach 28. So this is the stomach 28. Its location on the lower abdomen. This is point on the lower abdomen. 2 chun lateral to the midline. 2 chun lateral from the midline and 3 chun inferior from the umbilicus. Inferior means downward. Okay, 2, 3 chun, four finger downward from the come straight midline to the 3 chun below the umbilicus, navel, and after coming 3 chun, go after coming 3 chun, go 2 chun lateral, 2 chun lateral. Okay, this is the location of the stomach 28. This is the stomach 28. Okay, see the video. One important information: you don't needle more than 1 chun with for this point. Okay, you should take the care of the needling to this point. Don't needle this point more than 1 chun. Our next point is the bladder 28. Bladder 28. Okay, this is the bladder 28. Okay, this is the backshoe point of the bladder. This point is the backshoe point for the bladder, and location is the 1.5 chun, 1.5 chun lateral to the midline at the level of the second posterior sacral foramen. Second sacral. Okay, we have the one bone. So that there are the fused bones. Sacral. There are the 4 sacral vertebrae. They are the fused, but we can imagine that there is the second sacral. Okay, okay. It is the 1.5 chun from the second sacral foramen. Okay. See, this is the bladder 28. See the video for how to okay. Now let's discuss. Let's see the SP6. spleen 6. This is the distal point called the inguinal region. Any problem in the inguinal region, we can select this point. Okay, this is the meeting point. This is a meeting point of the spleen, liver, and kidney channel. 3-inch channel. This is the meeting point of the 3-inch channel, SP6. So location, it is the 3 chun proximal from the prominence of the tip of the medial malleolus. Okay, see the location. Okay, on the medial side of the lower leg, 3 chun superior to the prominence of the medial malleolus in the depression close to the medial crest of the tibia. Okay, see the medial crest of the tibia. This is the big bone is the tibia. Okay, this is the medial crest. This line is the medial crest of the tibia, and it is the 3 chun, means 4 finger up from the tip of the medial malleolus. Okay, this is the SP6. See how to locate the SP6 again. Very important contraindication. Don't use this point in pregnancy. Immediate abortion will be there. Don't use this point in pregnancy. Our next point is the REN3, CV3, consumption vessels 3, REN3. This is the front new point. So we see in the back shoe point of the bladder. It was the bladder 28, and this is the front new point of the bladder. REN3 is the front new point of the bladder. This is the meeting point of the consumption vessels with the spleen, liver, and kidney channel. Okay, this also the 3-inch channels meet together on this point, REN3. Okay, what is the location? On the midline of the lower abdomen, midline of the lower abdomen, 4 chun below the umbilicus, and 1 chun superior to the pubic symphysis, and 1 chun proximal to the pubic bone. Okay, 4 chun downward from the umbilicus on the navel, and 1 chun superior to the pubic symphysis. Okay, this is the REN3. Okay, see the location, video location, how to locate. don't needle deeply. Okay, it may be penetrate the urinary bladder. This point. And next point is the REN 9. Okay, this point used for the water separation. We have to separate the water. It's called the dampness. Okay, we have to separate the water in these patterns. Okay, in damp heat. So this is the water separation point. REN 9. Location is on the midline on the abdomen, 1 tune above the umbilicus. This point is the 1 tune above the umbilicus and the 7 tune below the sternocostal angle. When the sternocostal, when sternum bone, you palpate the sternum bone, lower border of the sternum bone, and go down 7 tune or 1 tune above the umbilicus. This is the REN 9. See, this is the umbilicus, and this is count 1 tune up. One thumb breathe up. See the location. Okay, needle only 1 tune needle. Don't go above 1 tune. Only 1 tune. Okay. Now tell me how you like this session. What you learn from these sessions. So I'm going to unmute all. Unmute yourself. And tell me, so come on, don't write, come on board. Juka ji, unmute yourself, unmute yourself, unmute yourself. You can unmute yourself and tell what you got from this session.
Sir, the main meridian points are very beautifully explained. We cannot get this such sort of explanation in the books. It's very well explained.
Okay, thank you. Any more? So, how to explain, how to treat the painful and burning urinations? So, summary of this session, who will tell? Who will tell this? How to treat the burning and painful urination?
Can I tell, sir?
Yes. Start your video.
Yes, sir. The painful urination, that is acupuncture point for painful and burning urination. This is mainly due to the damp heat in the bladder. This is mainly in the lower geopattern. There are 3 geos in the body: upper, middle, and lower. This urination is due to lower geopattern. The main symptoms are frequent and urgent urination, burning pain on urination, stone or blood in urine. The analysis is exogenous pathogenic factor, overeating and drinking without control, abnormal function of key, bladder key not transforming, so it is abnormal. Then identification may be due to hot fire moving down in the small intestine. This is due to heart displeasure, thirst, insomnia, ulcer on tongue and mouth, frequent and urgent urine, then fever, soreness on lumbar. Dampness in bladder is etiology is exposure to exterior damp heat or dampness or cold. Emotional strain is underlying or accompanying pathogenic dampness and heat in bladder. Then signs and symptoms are frequent and urgent urination, difficult urination, dark yellow turbid urine, blood in urine, fever, thirst with desire to drink, hypogastric fullness, and pain and feeling hot, sand and stones in the urine. The treatments are SP9, bladder 22, stomach 28, bladder 28, SP6, CV3, and CV9. All the points has to be sedated.
Very good. Thank you. Very good. You are acupuncture rock star.
Thank you, sir.
Anyone? Hari? Hari?
सर नमस्ते.
नमस्ते. बोलिए.
नहीं मैडम सब एक्सप्लेन किया करेक्टली. ओनली एक ही करेक्शन था कि थर्स्ट विथ नो डिजायर ऑफ ड्रिंकिंग ओनली.
Yeah.
Rest all I think we good and rest all covered. Red spots on the tongue is one thing we are missing. एक था and red tongue and mouth ulcers due to heart heat transferring to small intestine. उतना ही करेक्शन था बस मेरे.
Okay. Thank you,
Thank
Hari ji. Okay. हाँ सुनील जी बोलिए.
सर मैडम ने जो एक्सप्लेन किया था मेरिडियंस के पॉइंट्स पे, ये जो लोकेशंस आपने बताई है एग्जैक्ट वी आर अंडरस्टैंड एंड ऑल इज सम करेक्शन इन देयर. वो एक सर जी ने अभी थोड़ा करेक्शन कराया था तो जो ऑल इज ओवर सर. वी अंडरस्टैंड वेरी. थैंक यू सर. थैंक यू वेरी मच सर.
And the points, the location of points is very well mentioned, sir. Really speaking, somebody has already mentioned this point. अच्छा था क्योंकि इतना easy नहीं मिलता है अभी. SP9 if you सब जगह में इतना clearly mention नहीं कर पाते. आपका वीडियो जो clarity देता है बहुत. Thank you, sir.
Very much clear. Thanks so much, sir. Thank you.
Okay, welcome. Thank you very much. Okay, for joining the sessions. So I think enough for today. Okay, closing the session.
Thank you, sir. Namaste.